Aspirin is a salicylate. It works by reducing substances in the body that cause pain, fever, and inflammation. Aspirin is used to treat pain and reduce fever or inflammation. It is sometimes used to treat or prevent heart attacks, strokes, and chest pains or angina. Aspirin should be used for cardiovascular conditions only under the supervision of a doctor. For patients on aspirin heart therapy, adding any NSAID for pain relief increases the risk of GI bleeding. And furthermore, taking brufen can compromise aspirin's cardioprotective benefit. I'm going to give a list of medical conditions and potential drug interactions to consider before recommending aspirin for pain management. Coexisting medical conditions to consider before recommending aspirin include stomach ulcers and GI bleeding, that is a gastrointestinal bleeding, patients who are aged 60 years or above, and patients with a history of GI problems who take any NSAID including aspirin are at high risk for serious GI effects such as stomach bleeding and ulcers. Hypertension. Aspirin and any other NSAIDs may be associated with modest increase in blood pressure. The adverse effects of NSAIDs on hypertension may have the most clinical impact in elderly patients who have a high prevalence of arthritis, hypertension, and NSAID use. Liver cirrhosis or liver disease. Aspirin and any other NSAIDs are metabolized in the liver and can therefore pose risks of problems. Aspirin can elevate hepatic enzymes, blood urea nitrogen, and serum creatinine. It can cause hyperkalemia, proteinuria, and prolonged bleeding time. Kidney dysfunction. For patients who have renal abnormalities, using aspirin or any other NSAIDs may lead to chronic kidney disease. Adverse renal events from NSAIDs may be dependent on dose and therapy duration and can include nephrotic syndrome, reduced glomerular filtration, and chronic renal failure. Patients with sodium-retaining conditions, for example congestive heart failure, renal failure, are often placed on sodium-restricted diets and must avoid high sodium-buffered aspirin products. Asthma is another condition. In some adults who have asthma, aspirin and other NSAIDs that inhibit COX-1 can aggravate the condition. Antiplatelet medicines, including low-dose aspirin, pose their own risks of GI complications and bleeding, like I mentioned earlier, and adding aspirin or any NSAID can compound these risks. Concomitant use of anticoagulants and NSAIDs also increase GI bleeding risks. Aspirin and any other NSAID may be associated with modest increase in blood pressure, like I mentioned earlier, and they may diminish the effect of certain antihypertensive agents, including beta blockers, ACE inhibitors, and diuretics. For patients on aspirin regime, the use of brufen can reduce aspirin cardioprotective benefit, and also taking NSAID while on aspirin therapy can increase the risk of GI bleeding. Using aspirin or other NSAIDs with corticosteroids increases the risk of severe stomach bleeding, possibly because steroids can decrease production of protective gastric mucus, which in turn can delay healing of NSAID-induced erosions. You can also consider not to use aspirin if you are allergic to aspirin or any other pain reliever or fever reducer, that is analgesic or antibiotic medicine. If a patient consumes 3 or more alcoholic drinks every day while taking aspirin or any other NSAID, again the chance of GI bleeding increases. Pharmacists should not recommend the use of aspirin in patients who are pregnant or nursing because aspirin can cause alterations in maternal and neonatal homeostasis, decreased birth weight, risk of perinatal mortality. Aspirin used during the last 3 weeks of pregnancy can lead to closure of the ductus arteriosus. If taken during the week prior to delivery, it can result in excessive blood loss during childbirth. Aspirin-induced prostaglandin inhibition can also prolong gestation and labor. When aspirin passes into breast milk, it can cause bleeding, rash, and platelet abnormalities in the infant. Raynaud's syndrome is another serious but rare condition that causes confusion, swelling in the brain, and damage the liver in children because of the effect of aspirin. Children recovering from a viral infection such as chickenpox or flu, or who have a metabolic disorder, are at most risk, especially if they have been taking aspirin. That is the risk of having the Raynaud's syndrome. Early symptoms of Raynaud's syndrome include diarrhea, rapid breathing, vomiting, and severe fatigue. Symptoms such as confusion, seizures, and loss of consciousness will require emergency treatment if they occur. Aspirin is indicated for temporary relief of pain, such as headache and fever, minor pain of arthritis, muscle pain, menstrual pain, and toothache. Thank you for staying tuned. See you in the next one.